Well, this week we continue our special series, Lessons from COVID-19, as we explore one Minnesota tribe's response to the pandemic. We sat down with Bois Forte Band Chair Cathy Chavers, who is also the first female president of Minnesota's Chippewa tribe. We asked her how the pandemic has affected day-to-day business on the reservation and what changes they have made.
I've heard that this was inevitable to come. I would never in my lifetime have thought that this pandemic would be here, but it's here. We started first hearing about the virus, of course, like everybody else. And so we started having Tribal Emergency Response Committee meetings as part of our emergency preparedness plan. We had daily meetings with our Turk committee. We call it our Turk committee. And implementing items of what do we need to do. We know we're going to need masks. We know we're going to need hand sanitizer. All the things that are part of the pandemic as normal now. We limited our travel. We set up a red zone within Bois Forte where we didn't want people traveling outside this area. If they did travel, they had to isolate for 2 weeks. And then we started getting, temperature checks. We're trying to get the equipment for our clinics. We have clinics in both Nett Lake and Vermilion. We were trying to get tests here, working with the state, working with the IHS. So a lot of work was initiated through our Turk committee with all the members of our emergency response planning committee together. Well, then eventually we ended up wondering basically how we were going to get this information out to our people. We have approximately 400 to 500 residents here at Nett Lake. In Vermilion, we have approximately 400 to 500 there. We know we have at least 200 to 400 band members in the Duluth area, and we know we have at least probably 1,000 tribal members in the Minneapolis area, but we know we have about 2,000 people in Minnesota. We also have our total band membership of 3,500 plus. And so we decided to do a video, and we did a video then. Basically, we were trying to do a video once a week. By using the videos, we were accessing not only people that were more tech savvy, but also those in the Virginia area, Eveleth, Minneapolis, or anywhere across the United States. We utilized YouTube, and also then we put it on our boisforte.com website, and then we have our Facebook page. So social media was a way to also get it out. We get our vaccines from Indian Health Service. And Indian Health Service gives us was started out with 100 vaccines per site. We started vaccinating our elderly, our chronically ill, and then even our fluent speakers, because our fluent speakers, we only have 5 left. And so we put them as high priority. Senator Tina Smith took time out of her busy schedule to come over to our Minneapolis vaccination clinic. And she was very impressed and so appreciative of what the tribes have done with regards to getting these vaccines out. We didn't vaccinate just our band members. We vaccinated family members, whether they were band members. It doesn't matter. It doesn't matter, because we need to vaccinate as many people as possible. And I'm not trying to be disrespectful here, but tribes are doing a much better job than the state with regards to vaccinating people. Because we know what to do with limited resources. We know how to access different ways and ideas. And just because of the limited funding we've been getting for many years from the federal government. So we know how to do that. The bad thing about this virus is it is causing a lot of havoc, and there's no more normal. But one of the good things that did come out of it is the technology. Technology came to the forefront for everybody. So these rural areas and these tribes and these reservations that are suffering from lack of broadband or lack of internet access, that stuff came to the forefront. And so we were running into difficulties with that, especially when it came to which employees were going to work in the office and which employees were going to work from home. But then we were also looking with employees with their chronic health conditions. How can we set them up? And so that posed a difficult challenge for us here at Bois Forte, but we managed with hotspots, what have you. It's affected each tribe differently. For example, the tribal leaders right away having daily calls, because we wanted to share resources, stories, what was working, what wasn't working, what are you doing, we're doing this. Then it got to where we included the state people. Then it got to where we included the federal people also wanted to be involved. So to keep that network open from federal, state to tribe. I think a lot of us have been impacted differently, but we're all utilizing resources amongst us to help us through those times of need. Our tradition and our culture are pulling us through this.